reimagining healthcare, something that we spoke about yesterday, revisiting universal healthcare beyond the pandemic. And our moderator for this panel discussion is Chris Hardesty, who is a steward of innovation acceleration across the healthcare ecosystem. As the director of KPMG's Global Healthcare and Life Sciences Center of Excellence, Chris is presently based in Singapore, looking after developments in the Asia-Pacific region. Of course, prior postings have included Europe, US, and Brazil. We're looking forward to his experience and his expertise as he definitely navigates this particular discussion. Chris, over to you. Welcome.
Wow, many thanks. What an exciting intro. I'd love to be introduced like that every day. Greetings to everyone out there. I hope you're enjoying a forum. What a fantastic lineup, some great content. And what an exciting time to be in healthcare, honestly. I think there's so much attention, to this industry now. And I think as you'll hear from our fellow panelists, we're all passionate about this space, and it's just a great time. In fact, we're so passionate that 3 of us are calling in from Singapore, and it's 10:30 p.m. at night. That's how much we love this field, and we love to be with you guys. So, yes, my name is Chris Hardesty. So I lead KPMG's healthcare and life sciences practice for the Asia Pacific region. So working a lot on the design of health systems and the financing of health systems, including UHC SDG number 3. What we're going to talk a little bit about today is an interesting program that we're leading out here, which is basically looking even beyond UHC at how to make a generational impact in the way the systems are financed and designed. This is a World Economic Forum program that's being run that's quite exciting. So we'll have a little bit of content, and then we'll get into the panelists. And honestly, we have some prepared kind of discussion topics, but we'd love to just take your questions and hear from you guys out there and how we can compare what's going on in the Asia Pacific region to other parts of the world too. So please feel free to put your questions in the chat, and we'll jump straight to those, no problem at all. We're also going to have a few polls going throughout. So I think we'll run the first poll now and just try to get a sense of, for all of you listening out there, what your experience is already in the Asia Pacific region. If none at all, that's perfectly fine, but just trying to understand the audience a little bit out there too. Before I do get into the content, to get into the panelists though, we do have the minister here. So what I'd like to do is call on him and have him make some opening remarks and comments from his vantage point. So Minister Dayal Singh, he's the Minister of the Ministry of Health, Republic Trinidad and Tobago. He's held other roles in the government in terms of labor reform and finance reform. So I think he brings a very diverse perspective to the healthcare topic. In addition to that, he's a lecturer at INTAD. So that's a very short bio, obviously not deserving, fully. We need to say more about him, but I'll let him do that himself. So, Minister, over to you. I'd love to hear your remarks. Thanks.
Thank you very much, and thank you for organizing this roundtable discussion. Good morning to all esteemed guests. I have 3 minutes, and my timer is on, so fear not. On the issue of reimagining healthcare, universal healthcare, new models of funding, Trinidad and Tobago has always pursued a free primary, secondary, and tertiary healthcare model for all citizens of Trinidad and Tobago. It is not an insurance-based model, but it is funded out of our general collection of taxes and revenues. We currently spend in the healthcare system about $6 billion TT dollars a year in providing this free healthcare service. So that is what it is. That is how it is financed. We have to reimagine healthcare, and I'm not going to go into the details about providing telemedicine. Those are the tactical measures that governments could take. We have done all those things, providing free pulse oximeters for people at home and so on. What I would like to focus on and tickle the imagination of panelists are the strategic issues. That is, the psychological shift post-COVID that both healthcare workers and patients are going to have to adopt to move from the old touchy-feely, going before a doctor, being examined, getting a prescription, going to a pharmacy. We are going to have to tackle and break this up into segments. People in the population who are innovators, early and late adopters and laggards, as to how they adopt and manage technology. it is going to come with a high price, not necessarily in dollars and cents, but in new skills and behavioral strengthening to adopt the new model vis-a-vis the old face-to-face model, which many elderly people are accustomed to. So the mandate going forward from the Trinidad and Tobago perspective is how do we build patient confidence in a new world of technology vis-a-vis the old touchy-feely face-to-face. This will allow us to manage risk and exposure to healthcare workers and also risk and exposure to patients in a more sterile, non-touchy-feely atmosphere. So those are the strategic issues I think we are going to have to face as policymakers. And in my last 10 seconds, I want to thank everyone for the opportunity to present this morning the strategic intent moving forward. My 3 minutes are up. It's now 3 minutes. Thank you very, very much.
Very efficient, Minister. Thank you. And I love that, actually, because one of the things we talked about for today, and I'm going to share the content here in just a minute of some things we're working on in the Asia Pacific, but this philosophy about something to teach, something to learn, because in reality, I think a lot of our health systems have great innovations, but also challenges that we can share all around the world. So thanks for being succinct there. And I'll come back to you in a few minutes before you have to leave to hear some more comments, okay? All right, so what we're going to do next, I'm going to very briefly show you what we're working on in the Asia Pacific region on this, sustainable health system design program, and then we'll get into the panel. And again, please ask your questions for particular people or on topics, and we'll take those straight away. So just bear with me for a few minutes here. Hope everyone can see that. So we use this kind of terminology in the Asia Pacific, which is less than 10 years to achieve our goals. And it's not just because of the United Nations Sustainable Development Goals, but also because if you look at the fundamental design of a lot of the UHC programs here, there's actually not enough funding that would sustain into the next generation. So that's what I'll talk a little bit about here today, again, very quickly. So what we're trying to do is break these or break out of these triple, constraint, the iron triangle constraints, into really what we would call a triple win. So that is how you create an actual industry around healthcare for the region that would last into the next generation. And so we look at a few of the kind of underlying issues with the design of the UHC programs. Obviously, on the demand side, I don't have to tell people on this phone about the rising pressures there. We do look at the demographic dividend concept out here, which is the ratio of working age people to those in need, in terms of this is really the investment period for this part of the world to rapidly grow its GDP. And really then the language is around, especially after COVID time, is how do we make better use of what we already have, the billions and trillions of dollars that are being allocated into health systems already. Even though most of our health systems percentage of GDP spend is 5% or less, it still adds up to quite a sizable number. So, we don't currently meet herd immunity targets. We don't really do a lot for prevention as compared to what we could, and just the whole value of innovation on services and product side needs to be evolved. But probably the part that doesn't get talked about enough, and where we focus a lot on this World Economic Forum program, is the financing base. Because if you don't tax 15% of your GDP, then it's not considered a sustainable source of revenue for social services. And almost no country in the Asia Pacific region taxes 15% of their GDP. And if you think about social insurance schemes through employer contribution, 80% of people in the region are in the informal workforce anyway. And so what happens is basically we're twice the recommended world average for out-of-pocket expenditure control. So people are, falling back into poverty as a result of UHC and not necessarily progressing forward. So what are some of the things we're working on? Again, in the essence of time, I briefed this very quickly. We're looking at some near-term efficiency gains here. So first of all, more kind of cross-governmental KPIs around healthcare, like the well-being KPI that they have in New Zealand, for example, and harnessing that demographic dividend period. We're trying to really make a difference on the prevention topic, and not just healthy lifestyle, but also earlier screening, concepts like self-care for people to, control the cost and control the pathways themselves so as not to, eat up the resources. And then just adopting some of the next generation services. A lot of it is around task shifting and, of course, digital health. We can get into that during the panel. And finally, just more evidence-based decision-making around the products and services that are being used. So initially a kind of blended scheme as we evolve out of fee-for-service, but ultimately into bundled and even cost containment type models, as well as the adoption of health technology assessments. And then we're trying to be even more creative with some of the financing schemes too. So here we're looking at combining tax and premium contribution models. This is what Japan has done into like a composite scheme. We're also encouraging automated enrollments like what Philippines has done. And then just the role of private insurance. In the Asia Pacific, private insurance penetration is less than 5%. So there's a lot of room to grow there too. And then even thinking beyond, we are interested in concepts like social impact bonds that have been rolled out in Canada and Japan, nationalized health savings programs like what we have in Singapore. And I think you'll hear from, for example, Adrienne, they do a lot of applications of fintech into the healthcare setting too, which is all quite exciting. So that's that. There's a link here down at the bottom. This is the World Economic Forum program. We've kicked off a set of workshops happening all across the region over the next few months. We're focusing on a few high impact areas like life course immunization, diabetes, and rare disease. And the idea is for the annual meeting coming up in the August timeframe that we would actually be able to present back out what have been some of the findings. So stay tuned there, but we have some great blogs and other information on the World Economic Forum website too. All right. I said I was going to be quick because actually you want to hear more from the panel than from me. I just wanted to give you some food there for thinking. I do want to come back to the minister before he has to go and hear his thoughts on what I've just said. But while he's thinking of that, Ada, you're kind of my co-collaborator here with this Sustainable Health System program and the World Economic Forum and a bit of the brainchild behind it. So I'd love to just hear some remarks from you initially on what led to this program. So Ada is the Asia Pacific, Public Affairs lead for Sanofi. And like I said, we're working together on the Sustainable Healthcare program. So Ada, over to you for some comments.
Yep. Thank you, Chris. And good morning, good afternoon, and good evening, everyone. My name is Ada Wong. I'm the Regional Public Affairs Lead based out of Singapore, same as Chris and Adrienne here. It's definitely a pleasure for me to be part of today's, I would say, timely panel discussion. Never has the importance of sustainable healthcare system come into such a strong focus, given what the COVID-19 has exposed. However, as Chris mentioned, the sustainability of healthcare system has not been a major issue in this region. Where the most immediate and visible effects of COVID-19 pandemic are the morbidity, mortality, and the pressure on the healthcare system. And the COVID-19 also exposed the economic and social aspect of many lives and many countries. According to OECD, the economic impact on Asia has reached to $1.7 trillion US. And recent year in many countries in Asia has made a huge progress in terms of UHC. However, the COVID-19 has exposed the weakness of the healthcare system. Even high-income countries with well-established UHC, they also face a challenge how to expand the service more and ensure the financial sustainability in the long run. I think a lot of people have the same question is whether the COVID-19 will derail the quest of UHC. In fact, COVID-19 only exposed the underlying and pre-existing vulnerability of the healthcare system. And undoubtedly, I think the pandemic posed the new challenge given the resources and action has been posed to the COVID-19. But I'm a strong believer in terms of when there's a risk, there are opportunities. While many countries are facing financial burden in the immediate term, but during the COVID-19, I think increased the awareness and the need and the determinations that many countries want to improve the healthcare system for the long run before the next pandemic comes. We all can see that many of these developments toward of the COVID-19. However, those developments also contribute to the long-term healthcare sustainability as well. If I can give example, is pharmacy-based immunization. In the context of it, because of demand of COVID-19 vaccine administrations, many countries have expanded or going to leverage on community pharmacy as a part of the vaccination support. Empowering community pharmacy to do more, such as consultation, pharmacy-based immunization, I think it's a great example of any short-term action can bring the cost saving and long-term benefit to the healthcare system. As for Sanofi, we believe that one of the key to achieve the long-term sustainability of the healthcare system is the partnership between the private and the public sector. As such, that's why EU ASEAN Business Council and KPMG and Sanofi worked together back to 2020 on the EU ASEAN report, ASEAN Sustainability Healthcare Investment as Economic Driver, actually in the middle of COVID-19. And the report, as Chris mentioned, does cover a lot of the challenge and the checklist to take forward. I think for me, one of the key takeaway from the report is among all the healthcare measures, prevention simply is one of the most cost-effective means to achieve the resilient and sustainable of the healthcare system. And preventative care such as self-care, immunization, usually cheaper than cure, but they always receive less budget compared to our treatment infrastructure. Now COVID-19 increased awareness of importance of prevention. I think all of us, how to take this prevention concept into reality is very important. And thank you again to Hardesty for this important opportunities, and we look forward to the fruitful discussion. Back to you, Chris.
Great, many thanks, Ada. Minister, if it's okay, putting you on the spot, I know you have to leave in a few minutes, but and I do want to come on to Mandeep and Adrienne too and hear their thoughts, but I thought take advantage of you while you're here. I mean, based on what you've heard, Ada and I talking a little bit about what we're doing in the Asia Pacific region, just wondering if you have any reflections for us?
Yeah, sure. So the whole issue of universal healthcare, attending a WHO real meeting when we were allowed to congregate in Geneva, one of the takeaways is that there are many parts to universal healthcare, and different countries pursue different ways of reaching that particular goal. As the presenter said, yes, there are going to be opportunities, and we have already started taking advantage of some of these opportunities. But I think moving forward, as we reimagine healthcare and rely more on telemedicine, IT, one of the things we have to do in Trinidad and Tobago to make sure we don't have duplication of patients going to different centers seeking healthcare is the whole issue of giving patients a unique identifier. So a patient presenting to one healthcare facility, you plug in that unique identifier, and then we can have a full record of every intervention you have had in the public healthcare system. I think that is a main platform builder as we think about this whole thing about reimagining healthcare. How do we identify patients to make sure that you have a full history of what they have been getting? Because they are going to move from health facility to health facility. And we want to make sure we have their records. And we have started some tentative steps towards that, but we are going to be deepening that. So if I could just throw into the panel, how do you identify patients and this whole concept of a unique patient identifier?
Great, many thanks, and I think a very topical point, especially during COVID-19, when the idea of tracking people and movements in healthcare is quite hot. So I know you have to go in a few minutes, Minister. So maybe what I'll do is call on Mandeep, and Mandeep, of course, you can make introductory comments. If you have any reflections off what the minister said, feel free to do. Otherwise, we can continue this discussion during the panel. So Mandeep is with the UNDP Health and Development Group, the Bureau of Policy. She has a great background on topics like HIV and low to middle income countries. So again, would love to hear your opening remarks, Mandeep. And if you do have any reaction to what the minister just said too, feel free to chime on that before he has to leave.
Thank you so much, Chris, and it's a delight to join this wonderful panel. And I'll start with the minister's question because I know he has to leave. There's some fantastic experience using digital tools that's emerging now, and I think it's been accelerated by COVID. So there's some really good examples of using unique patient identifier numbers and things. For example, in India, in the national rollout of the COVID vaccination, but also in many other countries. So we'd be delighted to share some specific information on that if necessary. But I wanted to take a step back and really say a little bit something. I mean, it wouldn't be obvious to people that the United Nations Development Program has a health practice, but we do. And that's because health is an outcome, it's an indicator of human development. And our approach is very, very grounded in sustainability. And that's why I was really excited to join this event today. And when we talk about sustainability, we're talking about the three components of sustainability: social, economic, and environmental. So I really think, if you're thinking about building sustainable healthcare, building sustainable health systems, you really need to look at the three dimensions: the social dimensions, the economic dimensions, and the environmental dimensions. We need health systems that are climate resilient. And I think the minister will appreciate, coming from Trinidad and Tobago, how important it is to have climate resilient health systems, and that investments that are going into strengthening infrastructure and other systems related to health have to be climate resilient. So the environmental piece is really important. That said, the health sector itself is a major contributor to emissions. It's one, if you look at, if the health sector were a country, it would be the fourth largest emitter in the world. So the health sector, as we build anew in the health sector, we have to think about how we decarbonize the health sector and how do we reduce the emissions from the health sector. So things like, and a lot of that emission comes from the procurement sector and from the use of energy. So if we're going to build resilient and sustainable systems for health, we also need to look at greater use of renewable energy in the health sector. Make it more climate resilient, less use of energy, dirty energy, shall we say, less use of plastics within the health sector. So I think that from the environmental perspective, those are a couple of things that I'd like to flag. On the economic side, I think we have to look at all tools available to increase the investment in health at the domestic level. And what do I mean by that? I think things like health taxes, and UNDP together with WHO has done some very interesting work with countries, helping them to build investment cases on what are the best buys to get health outcomes. And, in Barbados, actually following an investment case, they introduced a sugar tax, which increased revenues for the government, but also, actually, I think is contributing to reducing some of the risk factors around non-communicable diseases. So I think there's some interesting tools to increase the resources for countries to be able to invest in health. And then the social side of things, I think there needs to be much more thought given to increasing equity, using data and digital tools to increase equity. And I think that's going to play a major role in COVID vaccination. How do we use data? How do we use digital to drive equity, to get to the last mile, to reach the hardest to reach? So I think those three components of sustainability, for me, are sort of the North Star of how we build resilient and sustainable systems for health that help us deliver on the goals of the 2030 agenda, because it is SDG 3, but SDG 3 is fundamentally linked to so many of the other SDGs. And Sustainable Development Goals. So I'll stop there. I think for me, I want to just agree with Ada and with you, Chris, that COVID-19 has really, I think, highlighted, and underscored in a very powerful way the importance of investing in universal health coverage. So in any just and green recovery from COVID-19, universal health coverage will have to be there. And we'll have to do it in a way that prepares us for the climate crisis and also prepares us for the next pandemic. So I think that's the other thing, is thinking now as we're building systems, what do we need for pandemic preparedness at the global level, at the regional level, at the country level? And one of the most obvious things to me is a global alert system. We have there's so much data being collected, but there isn't a global alert and response system. And I think that that's something that would be really critical in terms of strengthening systems. I'll stop. I'm going on for too long, but really excited to hear from the other panelists and to hear from the audience. And thank you, Minister, for the great work that you're doing in Trinidad and Tobago. Thank you.
Thank you, Mandeep. A very well-rounded perspective there, and I love this concept too. And you rightly said the SDGs, how they're all interwoven. And actually, if we want to really see the reform and transformation our people and our planet. We have to combine some of these efforts together, I think, and see how they go in sync. So I think that was very well said. And along that vein, last but certainly not least, I'll bring in Adrienne, who does a lot of this kind of multidisciplinary thinking on healthcare. So she has quite a good perspective there. She's in the business development director for Access Health, which she can explain more about that. And really, one thing I follow quite a bit of what Adrienne does is this application of fintech into healthcare too, which plays, I think, very nicely into what we're talking about here today. But anyway, I won't steal your thunder anymore. So Adrienne, over to you.
Thank you. I have to say it's going to be even more difficult to really stay focused on the topic that we're talking about today, especially following I think Mandeep's comments. It's very, so a bit of background. Access Health, we're a nonprofit think tank and advisory organization that focuses on the vision that all people should be able to access high quality, affordable healthcare. And so we're a founding member of the Joint Learning Network for Universal Health Coverage, which of course implies that we also, a lot of our work has supported governments as they go through the very practical processes of creating and strengthening universal health coverage systems. But in addition to that traditional work, as Chris mentioned, we also take a very intersectoral approach. So we have launched a FinTech for Health program with support from MetLife Foundation. But I'm going to go a little bit into that, but I would be remiss if I didn't quickly address something that Mandeep had said about having climate resilience and how healthcare feeds into that climate resilience. And so maybe another conversation for another day is also how, from a planetary health perspective, as we protect the climate, how do we, or for that climate resilience, how does that also improve human health? And similarly with pandemic preparedness as well, whether that is prevention, how that is also linked to climate health as well and conservation of natural areas. But staying focused on what we're talking about today, I think there's a few things around sustainability. One is, again, our focus right now, a lot of it, at least out of the Singapore office, is very much focused on how do we use technologies to strengthen universal health coverage systems and also address the fact that right now we're focused, the commitment is on achieving universal health coverage by 2030. In the meantime, there's going to remain very high out-of-pocket payments. And how do we use finance technologies and including the financial inclusion approaches and a number of the finance products that's usually offered in the formal finance systems. How do we offer that using technology and be able to offer the same suite of products to people who are unbanked and underbanked? Because as we look at financial inclusion programs, the unbanked and underbanked is a lot of times also the same population that we're looking at with universal health coverage to ensure equity when we look at access to high quality, affordable healthcare. And so we do look at this in two ways. One is that forward-facing, patient-facing, how do we address these high out-of-pocket payments so that people don't just have to borrow money from family and friends or from loan sharks, they don't have to sell assets, including income-generating assets, or they don't have to forego needed health care that can also impact their income as well. So how do we offer these trusted, transparent healthcare financing options? But then also what we do on the other side is look at the back end of how do we use technologies to make universal health coverage work better. One of my colleagues used to work for the Health Insurance Review Agency in South Korea, so she can speak, quite in depth on how the South Korean system through HERA is able to use technology for things like fraud detection and to be able to essentially have very efficient and effective use of their universal health coverage because they're using technology and they're using data. But we also see this potential in emerging markets as well. So if we're looking at a country that can maybe not afford the same technology systems that Korea is using, but how can you use billing? So something that sounds really simple. When we first launched FinTech for Health, people would kind of smirk at me a little bit and say, you mean payments? You're going to use digital payments? You're going to change healthcare with digital payments. But what we've learned from trying to implement these projects on the ground is that digital payments are very important and almost provide this digital infrastructure upon which you can start to create innovative financing models. And also they can be used as a way to gather that community-based data. It's going to be a lot quicker to roll out an e-payment system across the country, including for these small and medium-sized clinics and pharmacies, than it is to roll out a nationwide EHR system. So looking at just the data that we can gather from these e-billing statements, e-invoices, having the digital payments, if that data is going to a central repository, and of course anonymized, but if that's going to a central repository, health systems planners can use this to see what are the healthcare services that people are accessing at the community level. We can use this for this, an alert system for the next pandemic, is to be able to say, what are these little hotspots that we might not pick up because this care, the data from this care is not yet reaching a central system. So I'm going to pause there because this is a topic I literally could go on all night about. So I'll stop there.
All right, many thanks, Adrienne. And I think if you add up the collective set of knowledge here and the various facets that we're all doing, it's quite interesting. And this discussion could go on for hours, of course. Okay, so we got about 10 minutes left. I've been told we still have to kind of end on time. I'm going to attempt to get through 2 rounds of questions that have come through. So I'll just have to ask people if you can just try to be a bit concise so we can churn through. But let's see how we do. So we were going to ask about your views on sustainability of health systems and UHC, but I think a lot of you guys have already kind of touched on that. So I think let's come on to sort of the title of this section, which is what now happens as a result of the pandemic, right? So I guess, and again, with the Catalyst Forum, part of it is for the investors, right? Public, private, where do we make the investment? So I guess my question to you guys is, as a result of the pandemic, positive or negative, where should we be placing these investment bets? We talk about UHC, we talk about sustainability, but what is a bit different now, right? What are the good things? What are the bad things? So just a few words from each of you, and we'll try to get through one more round of questions. So maybe Ada, I come back to you since I started with you.
I do agree with the other 2 panelists mentioned about the TAD, but I think the data is very important. But one fundamental thing is, I think it's a concept change. That's why I would stick to prevention. I think that's a very common, very famous saying: vaccine doesn't save life, vaccination does. And I think back to 2019, WHO has identified vaccine hesitancy is one of the top 10 public health issues. That's why I think in this pandemic preparedness, how can we change the concept, the importance of the prevention, including self-care, maximize the benefits? How many countries have self-care in Asia Pacific? How many countries recognize that? Actually, not so much. How can we speed up the switching process from prescriptive to over-the-counter drugs? Or how can we adapt life course immunization? There's so many opportunities over there for multi-sector partnership, from policymakers, private sector, think tank, NGO, academia to work together in order to prepare the future. I think that for me is a very important point.
No, that's great. And I think there's a lot of confusion about what prevention can be, right? I think people tend to focus on only certain aspects of it and don't kind of understand this whole spectrum. So I think that's a great one, especially as health literacies are rising as a result of COVID-19. Mandeep, how about you? Where would you be placing your bets?
I would place my bets. I mean, I think on data, I totally agree, really important digital tools, but I think digital tools in the hands of people, because I fully agree with Ada on the prevention point. And one of the things that we certainly saw in HIV, I mean, not that we've succeeded on prevention in that area at all. There's still a long way to go, with 1.7 million deaths and new cases coming up every year. But I think the role of communities and community health workers is really critical. And putting these tools around data and digital in their hands is vital. And I'll just give you an example. We supported the government of India with a national scale-up of an app-based vaccination program called EVIN. And it basically tracks the vaccine from point of storage to getting it into the arms. And it basically empowers the health workers who have these apps on their phone to be able to, look at all the data on temperature, on the stock, on, when it's arriving, how much they can say, how much they need, how much they've used. So I think using digital tools and empowering communities, community health workers, I think is critical. And that even example now, it's really interesting. The government is adapting it for the COVID vaccination. So it just shows you how powerful, capacitating, and we've got women in the communities using this now for for vaccination and things like that. I think are really the way of the future. Using the digital tools, empowering workers at the community level, and that's how we will get to more universality in healthcare. Thanks.
I love it, and it's kind of like two groundswells that merge together now, right? So this community-based approach with the digital tools that were kind of there. They were just being a bit untapped, right? So I think that's a great example.
Yes, I think COVID's accelerated things.
Exactly.
Yeah.
Adrienne, how about you? Where are you placing your bets?
I agree with both what Ada said and with what Mandeep said as well, is that focus on prevention and also especially empowering frontline health workers, especially in the communities. The other thing that I think that COVID has really brought to light is the importance of communication. And a lot of times, in healthcare, we talk about right-siding care, making sure someone can get the right care at the right time in the right place. I think this has also shown us the opportunity to right-side information. Can you get accurate information when you need it in the way that you want to access information? So I think the importance of being able to get clear, accurate information around COVID, the countries that have really done well in containing the pandemic really put a lot of money and a lot of attention into their communications. And that's one thing that we see with FinTech for Health as well, is even how we think about the opportunities. A year ago, we were talking about innovative financing using technology. Now we're saying, how do you take these large platforms, which honestly, FinTech just reaches more people than most digital health platforms, is how do you use those to deliver information?
Oh, thank you. Went on mute somehow.
I got muted. But yeah, how do you also use it to deliver information, which we saw important during COVID as well?
Yeah, great. And in a way, none of what you are talking about are sort of possible, unilaterally. It sort of involves all of these aspects: health literacy and digital tools and personal empowerment and taking more costs out of the system through prevention. So I think you've all talked about your individual bets, but in a way it's a kind of collective bet too. So that's good. Okay, so I'll ask you each one more question. You'll have to kind of do it sort of 30 seconds each, but this is the Catalyst Forum, right? So I guess my challenge to you guys would be, what is going to be your catalyst moment of 2021? Is whether it's something you're working on or something you would like to see happen this year, what is going to be that catalyst moment for your realm of the ecosystem? So again, Ada, I come to you. You've had the most time to be patient there. So
I would say multi-sector partnership. I think I remember one of the panelists on day one mentioned, now even competitors can work together. COVID-19 create that platform, let all sector along the value chain to work together. I think that's the biggest moment. Then we have a chance to solve the issues and tap on the opportunities together.
That's great. I think all of us have just been amazed at the speed and the types of partnerships that have been happening over the last years. So hopefully something that continues for sure. Mandeep, how about you? What's going to be your catalyst moment?
Yeah, for me, the catalyst moment is really is very similar to Ada's. It's about how we're building all these new partnerships. I mean, this Catalyst Health Innovation Summit would not necessarily have been the kind of thing that I would have been thinking about before or been part of before. So I think the new partnerships facilitated by these lovely digital tools like Zoom and Teams and platforms, the ability to work together to help countries deliver on COVID vaccination. For me, that's the big catalyst moment. And we won't be able to do it without new partnerships and new tools. So that for me is the big moment. Thanks.
Yeah, that's great. I mean, other than battling time zone, it's pretty amazing how we can all just rapidly convene and work and sort of be talking to each other. So, okay, Adrienne, final word from you. Bring us home here.
It's difficult for me not to talk about partnerships, but I would say, taking these partnerships and putting them into more formal sandboxes. So started to refer to last year as the COVID sandbox. Everything that you couldn't do beforehand, you all of a sudden could do, but then no one knows where to make those investments because they don't know where the real sandbox is. So that's what we're moving forward is how do we put some boundaries around that so that we can really enable more of these partnerships.
Yeah, that's great. And I think, there are starting to be more examples of sandboxes. So there's certainly not starting from scratch here and what we can leverage elsewhere too. So, all right. Well, I know Chloe said I really have to end on time. Otherwise, I was going to be in trouble. So I don't want to be in trouble. So many thanks to all of you out there for tuning in. I hope maybe you got some nuggets here about the sustainability of what we're trying to do by 2030, but also how COVID-19 has accelerated or changed the situation and really what we're all trying to do to make a generational impact. And if I could just leave you with the concept, it would be, evolving out of this kind of rhetoric of health for wealth and into one thing that I really like and heard recently, which is health creation, and it's really just about every aspect of our society and business and public-private sector in some way can contribute into healthcare. And I think that's what Mandeep was touching on a little bit earlier too. So I think it's something we can all think about on a daily basis and how we contribute to health creation, even beyond the wealth creation aspect. So anyway, thanks again. Hope you enjoy the rest of the forum. Some great lineup there. And I guess Chloe, Terry, Carell, back over to you guys. Thanks.
All right. Thank you so very much, Chris. I absolutely loved that panel discussion. And it's interesting because Chris there and some of the panelists were actually tuning in from Singapore. And we just want to, again, thank our panelists, our moderators, everyone who is contributing because we're all over the globe sharing different time zones. And where it is morning here, we really would like to thank you guys for your time. And I had the opportunity of visiting Singapore. Beautiful country, beautiful people. And I think good night is Selamat Malam. I think that's how you kind of say good night. But thank you so very much for your time. Amazing nuggets dropped. Looking at health creation versus wealth creation. Reimagining healthcare requires us also looking at the psychological effect on our frontline workers beyond the pandemic. That's something very important. We're looking at the mindset shift. And one of the panelists spoke about prevention. So yeah, we're all trying to treat what we're going through right now, but what we need to do beyond the pandemic as we reimagine is start really normalizing conversations around the preventative measures. And certainly we brought in the SDGs, the Sustainable Development Goals, meaning whatever tools, whatever healthcare discussions we need to have, we need to be looking at the sustainable part of it to make sure that we are aligning with our SDGs. Fantastic discussion. Really got a lot of insight from that. So we are jumping right into our next panel discussion, and the